Hello, my name is Brittany Newton and I'm a health educator. I will be presenting a proposal about maternal mortality among African American women in the United States. First, I would like to discuss the problem. Studies have shown that African American women have higher rates of maternal mortality than other races in the United States. During 2011 through 2014, there were 44 African Americans maternal deaths per 100,000 live births, whereas white women and women of other races have 13 and 14 deaths per 100,000 live births, respectively. African American women have higher rates because they are socioeconomically disadvantaged compared to other women. Due to lack of access to care or low income, they are less likely to receive prenatal care. Even when they do not have a disadvantage, they may not want to seek care because of an inadequate care they may receive. African American women experience racial inequality, which results in them receiving substandard care. Some professionals may argue that they receive the same care, but African American women tend to have chronic diseases such as hypertension that cause pregnancy complications. Therefore, women need more attention during and after pregnancy. However, they lack proper prenatal care. Additionally, African American women suffer from higher maternal mortality rates in areas where they will be discriminated against. They also suffer in places where professional organizations and providers have not accepted the fact that African American women should be attended to differently because of their increased risk of chronic diseases. They should also be attended to differently because African American women develop risk for pregnancy complications at an earlier age than other women. And when examining the contributing factors of maternal mortality in African American women, that they are more likely to have chronic health conditions such as obesity, diabetes, and hypertension. These chronic health conditions make them have higher risk for having pregnancy complications before, during, and after birth. Even with access to health care, African American women suffer from discrimination in hospitals and in society. Discrimination in hospitals results to having African American women having lower quality of service than white women. Additionally, most African American women are only insured during pregnancy, in which they can receive Medicaid. Since most of the African American women tend not to have insurance after pregnancy, they don't go to the doctor to receive the care they need, especially if they have chronic health problems. And when these problems go unattended, they can experience postpartum preeclampsia if they have hypertension or other complications. Therefore, the problem statement is, due to African American women being more likely to develop chronic diseases and experience racial inequalities in hospitals and in society, they have higher rates of maternal mortality than other women in the United States. So when looking at this problem through the social ecological model, one can see that what helps and hinders maternal mortality among African American women at each level. At the individual level, what hinders African American women is that they have poor health and experience an increased risk for chronic diseases such as hypertension and heart disease during pregnancy. They also experience a higher risk for preeclampsia. Also, at the individual level, what helps African American women is that they know how to seek prenatal care. With prenatal care, chronic conditions are assessed during the third trimester. When looking at the interpersonal level, what hinders African American women is that they experience cultural mistrust. Cultural mistrust refers to dissatisfaction with health care and delayed medical treatment. This stems from a family legacy of medical mistreatment, scientific and medical experimentation against African American women. But at the interpersonal level, what helps them is that African American women are being able to trust their medical provider with their health to receive adequate care, and by not fearing discrimination in society and in healthcare facilities. At the organization level, what hinders African American women is that healthcare facilities lack cultural competence. When medical providers lack cultural competence, there becomes a stigma between the patient and the provider. This results in African American women not wanting to get prenatal care. What helps them at this level is that medical facilities being able to have cultural competence and providers listen to African American women that when they experience complications. At the community level, what hinders African Americans is that they have unequal access to health care. They are more likely to lack insurance and receive poor quality of medical care. What helps them is that they have equal access to health care. So when you're looking at the policy level, what hinders African American women is that there are racially discriminatory policies that affect people from getting healthcare access or quality treatment to care. But what helps them is that the Affordable Care Act allows people who are uninsured or underinsured to have the healthcare access they need. After examining the social ecological model, I propose some interventions to help reduce maternal mortality rates among African American women. The first intervention is calcium supplementation. This intervention will relate to my problem and the model by relating to the individual level of the model. At the individual level, African American women are hindered by being more at risk for preeclampsia. Evidence shows that women in the dietary supplementation with calcium more than halves the incidence of preeclampsia. Additionally, calcium supplementation reduces maternal mortality by 20%. The second intervention that I'm proposing is preconception education. This relates to the model and maternal mortality among African American women by relating back to the individual level. At the individual level, African American women are hindered because they are at risk for chronic diseases. With preconception education, women would be provided information about the pros and cons of their behaviors before, during, and after pregnancy. The intervention would cover education on topics such as nutrition, birth control methods, and control of chronic diseases. It is important for these women to be educated on nutrition and chronic issues because they have an increased risk for mortality and their risk of chronic health issues. The last intervention that I'm proposing is a community-based intervention package. This intervention will involve where the outreach workers are trained on basic care, education to mothers, and community mobilization. The education on care will not only include basic information, but also information for African American women. These women need more attention, and that because they are higher risk. It will also include community mobilization where outreach workers will connect with religious leaders to educate them on the importance of birth control and family planning. This relates to the social ecological model within the organization level. In the organizational level, African American women are hindered by the lack of cultural competence among medical providers. An intervention to help with cultural competence would stop the stigma of medical providers, and these women would get the care they need. So now that we have proposed the intervention, let's look at the proposed evaluation. So for the calcium supplementation, this we will know this is successful by looking at the incidence rate of preeclampsia. And if the incidence have decreased in the African American women, we know it is successful. And this will be measured by blood pressure readings and blood tests. For the preconception education intervention, we will know it's successful if it has increased the number of pregnant women being able to eat healthier. This will be measured by folic acid tests and women getting weighed in by their doctors. And finally, the community-based intervention packages will be successful if outreach workers increase their knowledge about antenatal care for built relationships with religious leaders about family planning. And this will be measured by surveys and observations. So when looking at the logic model, we have inputs. And in the inputs, we have healthcare staff to perform blood pressure tests, calcium tests, and blood tests. Staff to conduct surveys, questionnaires, observations, and support program implementation. Outreach workers to train on antenatal care and to give care to pregnant women. Training curriculum for outreach workers and healthcare providers. Surveys, questionnaires, guidelines to reference to when the women complete the surveys and questionnaires, funding to implement the interventions, and then intervention work area to conduct the intervention. So the first activity would be to conduct an intervention for African American women to find out their risk for preeclampsia through surveys and blood test pressure regions. The output is that the blood pressure regions are collected for African American women and the history about their health, weight, exercise, and family history was gathered. The outcome is that the incidence of preeclampsia has decreased in African American women. Then a second activity is that we conduct an intervention to increase the knowledge about calcium supplements, helping blood pressure and calcium tests given to African American women to check the calcium levels. The output is that the knowledge about calcium supplements was enhanced and calcium levels were checked and monitored. The outcome is that there are more African American pregnant women are using calcium supplements to reduce their risk of developing preeclampsia. Another activity is that we will conduct the intervention to have activities to learn about nutrition and the effects of pregnancy using games and teaching. The workshop will also include surveys on vegetable, fruit, and protein intake, folic acid tests, and staff will examine their weight. The output is that knowledge about the importance of healthy diet is increased. African Americans women's folic acid consumption is known. Food intake is known and the weight is monitored. The outcome is that there are more pregnant African American women conscious about their eating habits and their eating healthier and increasing their consumption of folic acid. From these three activities that I just discussed, the impact of this is that there is a decreased maternal mortality rate for African American women in the United States. Now looking at the different activity, there will be a class as intervention to train outreach workers about the antenatal care for high-risk patients. The output is that outreach workers are trained on antenatal care for high-risk patients. The outcome is that outreach workers are becoming aware of the needs of African American women, and that the impact is that the outreach workers are very knowledgeable about the care for African American women and other women that are high risk for preeclampsia and pregnancy complications. Another activity that I'm going to discuss is that there will be an activity to observe and test the outreach workers on the care. The output is that knowledge of the care is being tested in a patient setting. The outcome is that the outreach workers are increased on their knowledge about the care for all women, including African American women. The impact is that outreach workers know how to effectively examine and treat African American pregnant women. Another activity is that we will reach out to hospitals, corporations, and other organizations to raise money. The output is that awareness about the intervention has been given to the hospital, corporations, and organizations. The outcomes is that the intervention is receiving funding. The impact of this is that funding has helped improve the health of African American women. And finally, the last activity is to search locations to conduct the intervention. Several locations have been found for the output, and then the outcomes is that intervention has place to be conducted. The impact is that having a place to conduct the interventions helped improve the health of African American women. So with any potential intervention or evaluation, there becomes challenges. The first challenge is observer bias. There will be bias with the health educators observing the outreach workers. And this is a bias because they have observer bias and subjectivity. In order to overcome this challenge, there must be investigators that are well-trained health educators. The observers must have a clear list of requirements that the outreach workers must follow without any changes, and finally they must be screened before they observe to eliminate any potential bias. The second challenge is that data collection from surveys and questionnaires. This is a challenge because women may not feel like they need to provide accurate and honest answers. And in order to overcome this, staff may need to discuss the importance of the surveys before the women are given the surveys and questionnaires. Staff must also ask the women to complete all questions honestly. In addition to discussing the importance, staff may need to observe their day-to-day routines for a week to see their eating habits and see if they're exercising. In closing, I would like to thank you all for your time.